UCA faculty and staff, as you all plan for a return to campus, I want to share some very important protocols we have put into place to ensure your safety and that of our entire campus community. First of all, I want to address face coverings. All UCA faculty and staff will be required to wear face coverings when in enclosed spaces where social distancing cannot be maintained, including in shared offices, classrooms, meeting rooms, lobbies, elevators, restrooms, and corridors, as well as in high traffic buildings such as the Student Center and the library. You're free to wear your own face covering, and UCA will provide you with a face covering should you need one. These will be distributed to you by your building administrator upon your return to campus. We will continue to emphasize the CDC's recommended measures for reducing the spread of virus, including coughing and sneezing into your elbow or a tissue, avoiding shaking hands, and washing hands frequently with soap and water for at least 20 seconds. You can also use an alcohol-based sanitizer with at least 60% alcohol. We have increased the number of sanitizing stations set up around campus. They can be found in many high-traffic and high-contact areas and in building lobbies. We will abide by the CDC's social distancing guidelines, which recommends staying at least 6 feet from other people and not gathering in groups. This means that you should not congregate in break rooms or other small enclosed spaces where you cannot maintain 6 feet from others. Signage will be posting advising individuals of social distancing and personal hygiene guidance at various locations on campus, such as near elevators and near stairwells. Each office should reconfigure shared workspaces and other common areas such as break rooms to maintain 6 feet of physical distance at all times and minimize opportunities for congregating. Please be mindful of your proximity to others at all times. As you come back to campus, please know that we have enhanced cleaning and sanitizing measures all across campus. Custodial staff are cleaning on a daily basis and focusing on all touch points, including desktops, light switches, and doorknobs. Interior doors should be propped open where feasible to minimize the necessity for frequent touching. In shared kitchens and break rooms, the CDC recommends that you do not share dishes, glasses, cups, or utensils. Use disposable items whenever you can, or use your own items and wash immediately after use. In-person meetings should be limited during this time. Continue to use video conferencing platforms as appropriate. When in-person meetings are necessary, limit meetings to no more than 10 individuals, and all must wear face coverings if social distancing is not possible. All surfaces should be wiped down with sanitizing wipes after each meeting. Areas such as the Christian cafeteria and the Student Center will continue to be to-go only at this time to maintain social distancing guidelines. We ask that you not congregate in these areas. For those areas where lines typically form, please pay attention to the signage and decals on the floor that indicate 6 feet of distance. During our phased return to work, we want to keep our campus visitors at a minimum, only allowing necessary deliveries and those visits that are critical to everyday operations. Please do not invite your spouse, friends, or other unnecessary guests to campus, as this could diminish our efforts to keep the campus community healthy. Finally, one of the most important guidelines is this: if you are sick, do not come to work. If you've had any of the following symptoms, stay home and contact your healthcare provider or our student health clinic immediately. A fever of 100.4 degrees or greater in the last 2 days, a cough, difficulty breathing, a sore throat, or a loss of taste and smell. Additionally, if you've had contact with a person known to be infected with COVID-19 in the previous 14 days, It's imperative that you stay home in self-quarantine for another 14 days to ensure that you are not infected. Thank you all for your continued commitment to UCA and to keeping our campus community healthy. I look forward to seeing you all on campus soon. Go Bears!